Hi, Julia. Nice to meet you again at the annual meeting of CAPTIVATE.
Hi, Erika. Nice to meet you too.
So, yeah, did you enjoy the discussions today?
Yeah, it was quite exciting to see all the partners discussing together about the achievements on the project. So, a nice, I would say, next steps. And I'm looking forward to knowing the outcome of the project.
So, I understand from today that Quantum joined the project, though they worked on viruses in the past that were sort of simpler. So, can you explain why Quantum was keen on joining a project that was probably having an increased level of difficulty?
Well, for us, it was the opportunity to explore the full potential of mRNA-based vaccines, because, as you say, working with viral diseases was more easy, if we can say. And here it was the opportunity to actually challenge our design capability and see whether we are capable of, complicating a little bit the design aspects and whether we can still predict the behavior of the mRNA once delivered to the targeted recipient, and whether we can get the expected level of immune protection with our vaccines.
Yeah, I would say that initial results were quite impressive. The
Yes.
ELISA results and so on and so forth were quite impressive. You get good levels of protection. Of course, the proof of the pudding is yet to
Yeah.
come with additional tests
Yeah.
and so on and so forth. And probably the combination, now that we know that both type of antigens have a similar
Yeah.
level of protection. So that's kind of intriguing and also kind of cool, I would say.
Yeah,
What do you
looking
think?
forward to the ultimate result and then to the next in vivo study that we're foreseeing. And on your side, what do you expect to achieve with this project?
Well, I think, we are in this project because we believe that non-human primates can give us insights that we can't gain from human studies, and in particular at the level of immunology. Immunological knowledge is a must if you want. We have heard from the World Health Organization representative that there are huge gaps, and that in malaria we haven't yet had an identification of any correlates of protection. And I think that correlates of protections are really important to tell us which way we have to go when we want to have a more efficacious vaccine. And I think and I hope that our non-human primate studies that have been approved by the ethics committees in the Netherlands will actually fill that gap. So I'm quite excited about the possibility to break new ground, I guess.
And why did you propose this project to the European Commission?
Well, I think that when the consortium came together, BPRC and myself were one of the promoters, and BPRC, as probably is specialized in compassionate research, so research that pharma companies are not so interested in because there's not so much profit to be gained. And, in that context, I think that as Europe and as scientists in Europe, for me, it was particularly important to touch upon the aspect of human rights. And the right to health is a human right. And I think it's a right that in Europe is quite safely part of the social welfare package that many governments have implemented. In Italy, it's even a right that is enshrined in the Constitution. It's Article 3 of the Constitution. But for other countries, poorer countries that don't have as much budget, it's more difficult to ensure the right to health. And so I believe that it's part of the European programs, also from the European aura, to be able to provide in this context. And I'm, quite honestly, quite proud that as scientists we can contribute to global access to healthcare and the right to health. So that's, some very inspiring. To me, it's very inspiring. What would you say are the main hurdles? What do we think about when we are thinking about mRNA vaccines and when we're thinking about developing them, designing them, and so on and so forth?
So I think that there are some quite critical aspects to be considered. And one of the most important aspects is that you can make the best design possible if you don't have the right antigen or that is not presented as it should be, so that it's available to the immune system, then it will not work. So first of all, you need to make sure that the amino acid sequence that will be then translated into the nucleic acid sequence is the right one, that it contains all the components that will then drive the right, I would say, trafficking presentation of the expressed protein. This is the first thing, that the epitopes will be also, I would say, correctly exposed to the immune system after expression. Then at the design level itself, you need to make sure that the coding sequence is optimized so that it's the most, I would say, expressible in terms of the right codons that are selected. The known coding sequence will promote the highest possible expression initiation and the most suitable or expected persistence of the mRNA inside the cells. And beyond that, you also need to consider the manufacturability aspects, both of the DNA and the RNA, so that you get the most, I would say, perfect, pure integer product as possible, and without forgetting that mRNA is a drug substance and it should be packaged into a drug product. And so there is where the delivery system is very important to make sure that actually the mRNA is delivered to the right tissues, to the right cells, where they will be able to have their, I would say, expected action.
And I would say that for the moment, I mean, it was quite successful. If we are
Yes.
looking at what has been achieved, and now, well, we will. I think the next steps are, you said, the study in vivo, and then are you going to proceed to clinical trials? What's the next steps that you envisage after the in vivo, the next in vivo trial?
Hopefully we'll be able to really unravel the right, I would say, composition of the ultimately best vaccine candidate. And yeah, so the plans are to get the ultimate vaccine that will be selected into the first clinical trial at the end of the project.
That would be fantastic.
Yeah.
That would be an achievement,
Great
a real
hope.
big achievement.
And it's fully aligned with the mission of Quantum to make, I mean, biologicals available to all. So I'm very proud to be part of this project.
Yeah, and I think, I'm very proud that we are in it together and that we can work together on this. Yeah. And that's, I think, together combining the expertises of all the people that have been around the table today is the right way forward to break new ground and to really make something available for underprivileged people, also in endemic countries, which we should never forget. This is why we're doing it in first instance.
Certainly.
So, I think it's... I'm hopeful. And after today, surely.
Round of high fives.